Hello students, welcome to Microbiology PYQ series. Another basic SAQ which is frequently asked is on normal flora, definition, types and importance. So what we mean by normal flora or what is the introduction? See, normal flora refers to microorganisms that normally inhabit the skin and mucous membrane of healthy individuals without causing the disease. Simply put, there are many microorganisms which are always at different sites in our body, but they don't harm anyone in the normal scenario unless and until an exception is there. This is called normal flora. So what definition you will have to write in exam? In normal flora are the microorganisms that are regularly found on or within the human body and usually do not produce disease under normal circumstances. Okay. So, what are the types of normal flora? There are two types of normal flora. First is resident, which is permanently present in the particular body site and difficult to remove, as if that microorganisms would be there in each and every human beings. And second is transient flora, which are temporary microorganisms that remain for a short time and may disappear after hygiene or immune response. This needs slightly explanation. Transient, what the word means? Transient means not permanent. So what happens is that these are some microorganisms, okay, which are there because of lack of hygiene or lack of immune response. So they come, and whenever there is change in the body, they disappear. They are not permanent. Okay, they might generally be harming the body, whereas resident flora does not harm the body. So you have to write the definition of normal flora, types, and always write example. So what are the normal flora in different sites of the body? You would not be able to remember all, but at least try to remember one body part and one microorganism. Such as skin, you will always have staphylococcus epidermidis, corynebacterium and propionibacterium. In the mouth region, you will always have streptococcus mutans, lactobacillus and neisseria. In the intestine of the abdomen, you will always have E. coli. E. coli is a resident, permanent resident, bacteroids, and Enterococcus. In the vagina, you will always have lactobacillus, which we call Dodalin bacilli. And the upper respiratory tract, there is Streptococcus, Neisseria, and Haemophilus. Okay, what is the importance of normal flora? It prevents colonization by pathogenic organisms. Simply, it gives colonization resistance. If you have a house and somebody is already living in the house as a tenant, a new tenant cannot force it away because it is already occupied. Or like when you whenever you have a train journey, if a berth is already occupied by someone else, a third party cannot come and occupy it. Okay, it they help in the synthesis of vitamins such as vitamin K and some B vitamins. It stimulates development of the immune system. It helps in digestion and metabolism of nutrients. One exception and one point is, you have seen 4 points: that they prevent colonization, synthesis of vitamins, third is stimulate immune system, and fourth is digestion and metabolism. But fifth point is very important, is that these organisms sometimes become opportunistic pathogen if immunity decreases. It simply means that they lie in our body, and whenever they feel that our body is getting too weak, they get greedy, they want to take over the body, so they act like a pathogen. So E. coli, streptococcus, they suddenly become pathogenic to humans only when immunity is compromised. So it is a two-sided sword, a resident normal flora, that till it is present it helps, and once it founds the body to be weak, it attacks the body. This much is enough. Now you have enough material to write in your exams. See you in the next topic. Also, I will be adding how to pass the exam even if you don't know the answer too much. So please subscribe, share, like.